guys, this video is about implants for your mouth, dental implants. And the reason I wanted to do this is because I have had a total dental journey, and for someone who's so young, I mean at age 20, I was already missing a few teeth. I had tons of cavities and all kinds of stuff. I started going to the dentist. I got 8 cavities filled. I got a root canal. I got some extractions, my wisdom teeth done. I got a bridge. And just about a year and a half ago, I went ahead and got 2 implants where those teeth were missing. And had I known, had somebody explained to me the process, I might have done things a little differently. So I definitely wanted to talk and kind of do a public service, if you will, because I wish there was more on this like 5 years ago when I was considering all these options. So when I didn't have great insurance and I didn't have a lot of money and I was just a college student, when I had some teeth that needed work, I had a bad dentist who was like, well, let's just take the rest of the tooth out. Like, it's kind of a little bit more than we can fill, and it's a lot, so you could get a root canal, or we could just pull it, and it'd be a lot cheaper. So what did I do? I let them pull teeth, and it did save me the money then, but here I was now, 25, 26, I think I was, and I was missing these 2 teeth right here. Just gone. And I was a vocal performance major at the time at a university, and I was singing, and I remember my instructor being like, open your mouth, sing louder, you know, give a more rounded aw, come on, open, oh, you know. And he was like, oh my gosh. He like saw it in my mouth for the first time, and he was like, if you're serious about this music thing, you need to take care of this. You need to take care of yourself. Long story short, basically, I started doing the research on implants. And I learned that there's several steps to the process. So one is you go in for the consult. They do an x-ray, they take a look at the space, you know, they'll give you a budget, a quote, kind of like what's it going to cost with your insurance, and you can decide from there, you know, whether you want to pursue it. They'll do an inspection sort of to see how much bone is left. If you need a bone graft, which is like either your own bone taken from another part of your body, they like extract it and then they inject it in your gum to make sure you have a ridge wide enough to support a tooth now, because you do lose bone and like that gum area becomes thinner and thinner after it's been gone for a long time. So they will determine whether you need a bone graft. For me, they said, you know, you're still young, you haven't lost that much teeth, and you haven't, you didn't need the bone graft as much as an older person might. So then they measure the size of the space that you have to fill, and they determine like what size tooth would fit there. If they use like, they have a bunch of sizes, so they can replace the littlest teeth all the way to the biggest molars, and they have all kinds of sizes. Sorry for the construction sound in the background if you hear that. That's just construction. Nothing I can do about that. So anyway, for me, they said, you know, you're young and you don't need the bone graft. So I went in and I made the appointment. I took some time off of work, and they told me you could, in theory, go back to work after this appointment, like as if it's like a dental filling at your lunch break. You could go back. But if you decide to take these pain meds that we're giving you and this like sedative, basically, you need to have a driver take you here. You need to have a driver take you home, and you can't drive a vehicle and the whole time you're on the medication and all that. So step 1 was, you know, getting the consult. Step 2 is, do you need the bone graft? If you do, you get it done. And that can take months. Like, they have to let it heal, the bone that they implant in your, like, in your gum. They let that heal. Then once it's healed, it could be 3 months later or something, they will do the actual implant, which is a stainless steel or surgical steel post that they implant in your jaw. So basically they give you a bunch of meds, they sit you down in a chair. You can either do it awake or asleep. If they have you awake, they do kind of like a twilight thing where you really don't know what's going on, but you're technically awake. Anyway, then they drill into your gum and they implant a surgical steel. It's almost like having a screw. Both of the ones right here I have is just screws sitting in my gum. And then they make this thing called an abutment, which is like a cap to the screw. It's kind of a little bit rounded, and it sits on the top of the screw, like the screw head that you would, you know, screw a screwdriver into. So then they have to let that step heal. So like for me, I got it done in August, and then in January I went back and got the crown part that looks like the tooth put on the top. So you go in after the surgery for the implants, just the rods, you go in there and they check it out and they make sure everything's okay, and then they check your teeth color. your tooth color, and they say, okay, what color implant would you want? So we narrowed down, you know, between 3 shades. You know, this one's a little light if you're planning on bleaching. This one's a little yellow, so it doesn't quite match. This one's perfect right now, but if you plan on bleaching, or if you're gonna get older and you think your teeth are gonna get a little yellow, you know, you're in between these shades. Anyway, they pick a type of tooth, the size, the right, everything. And these things are anchored. They're not going to move for the rest of your life. The rods, at least. You can crack the crown that goes on top that looks like the tooth, but the implant itself is in your jaw. Like if your body was found on the side of the road and they'd removed your fingerprints, they removed everything, they'll see your surgical steel implants in your jaw. Like, that's crazy. I know it's a weird thing to think about, but I would be easily identifiable because I have 3 implants in my mouth. So my dental records would definitely turn me in. But anyway, side story. I know I'm strange. So after you get that done, it does hurt. I'm not gonna lie. Like, the worst part for me was swishing water around in my mouth to clean it. And they gave me like a special antibacterial, antiseptic like rinse that I had to use a couple times a day to make sure it didn't get infected. So they gave me a pain pill. They gave me some like not Ambien. The thing that relaxes you, Valium. Valium I took a night before in the morning of, then I had a pain pill that I took, and they also gave me the laughing gas and the Novocaine injections into my gums, so it numbed the whole area, my mouth, my lip, my chin, my cheek. It was all numb. I couldn't feel a thing. And then they also gave me an antibiotic, like amoxicillin, that I took for like a week or 2 after the procedure, just to make sure if I had any infections, I had the necessary antibiotic to kill it off. And then I waited a few months, and that part was awful, like the waiting part, because you basically have screws in your mouth. So if you're getting any like the front teeth done, ugh, it's awful. But nobody knew mine because they're in the back. Like even now, if I hadn't showed you, you never would have known. And the crowns, they did a really good job. I'm going to take out my retainer right now. Yes, I do have my retainer on. You can kind of see. I'm going to take that out and I'm going to show you what the finished implant looks like. And I actually got another implant yesterday on the other side, and that has no cap on it, so I get to show you both. If you don't like gross stuff, I would turn away now. Okay, so these are 2 finished ones. There's 1 tooth that's in the back that's like my natural tooth, and then 2 implants. So, natural, implant, implant. And they look just like my natural teeth, right? They did a really good job. They blend right in. Nobody would ever know. And honestly, now I don't think about it. It's been about a year and a half since I've gotten those done. I don't think like, oh, those are fake teeth. Oh, I have implants. They just feel like my normal teeth. You floss them like normal teeth. The biggest thing actually, I guess, is that when you floss them, and rather than just going down, like taking the floss in between the teeth, you can kind of shift it around, you know, like you floss. You actually have to go down the tooth and then scoop it under. The reason for that is, I wish I could do like a diagram for you, but basically there's a post sticking up, right? And then like the bottom of your gums are here. So the post goes underneath your gums into your jaw. Then when they're done, they install like a cap on the top that looks like a tooth, the crown, except for the fact that they can't get it exactly to your gum. So there is going to be a tiny, tiny little space between the crown that they put on the top and your gum line. So when you take the floss down, you have to take it down the side of the tooth and then under to make sure you're getting anything that could have gotten in that really tiny little space. Like you can't see that space. It's not visible to the eye, but there's enough space for things to get in there and get in bacteria and stuff. So you have to floss down, underneath them, and up. Down, underneath it, and up on both sides. Anyway, so on the other side of my mouth, I'm going to show you an implant. Now this is just the rod. This is not the cap or the crown. I put the 2 together. And this does have the abutment. It's very small and it has to heal like this for a few months. Let me show you. This is going to be difficult. Right here. Okay, I hope you could see that. But so I'm going to go back. This is August, the end of August. I'm going to go back after the first of the year, and I'm going to get the crown put on the top. And so let's talk about, well, the first time I remember I said I didn't need a bone graft, and they said I didn't. Then the doctor was drilling, and he goes, you know, I really would like a little extra bone for the best possible outcome. So what he did was he took the bone, my bone that he drilled out, and he used that and he packed it inside my gum to make a larger ridge to support those new teeth. And that was a lot cheaper than using artificial bone or getting the procedure to take my own bone from my body. It hurt a lot less. He was already going to take the bone out. I don't miss it. So, but this side, the guy said he did not need the bone. So I got a CT scan, which is basically like you sit in a chair and they have like a little thing that goes around you and takes a scan of your head and takes your jaw, your skull, I mean, and all your teeth, and it kind of shows the oral surgeon, or my dentist is my oral surgeon, what kind of space he's dealing with, how many millimeters he has until he hits a nerve down below, and all that good stuff. So anyway, they did the CT scan. I went in, I got the implant put in. I go back in 4 months or 3.5 months, and I get the crown put on the top. Let's talk about money here, okay? So the first time I got the implants, I had really good insurance, and they paid 95% of the procedure up to a cap of $2,500. So of course I maxed that out, like within one doctor's appointment. And I would say the total price was about $5,000, something around there. And that included everything from like the doctor's visits, the x-rays, the implants themselves, the rods, the crowns, everything, about $5,000. So that was 2 teeth though. On this side, I did it with a different dentist. So he sent me, the consult was free. You can find doctors that'll do the consult for free. Or what the initial doctor did was he charged me like $99 for the consult. So I went in there just to talk about implants. He charged me $99 and he said, if you decide to get the implant from us, I will put that $99 towards your treatment. So I found that was a very nice way to do it. He's like, I'm not going to just sit here and do all these consults for free all day, but if you get your procedure done with me, I'll cut you a deal, kind of a thing. So I found that was a really nice way to do that. The other doctor said free consult. So I don't know, you know, it depends on what your priorities are. I'm putting my retainer back in, don't mind me. Anyway, so they, then this time I paid $1,087 yesterday for just the post and the abutment. And my insurance now pays, they pay 50%. So that one tooth was about $2,200 just for the one thing. Then you'd have to pay in the 3 or 4 months later, you would pay to get the crown on top. That would be the cash price. It would be about $2,500 per tooth that you need to replace. So that's going to 2 different dentists on 2 different insurance plans. Came to about $1,100, $1,300, something like that per tooth with my insurance. I'm only providing those numbers because I want people to know that it's not unattainable, that if you save up and it's important to you, that you can do it. Also, they have a card called carecredit. It's used to be run by GE, but it's a 0% interest card that you can apply for, and they'll give you a credit line. Like when I initially started, they just said, here's $500 on this credit card. I used it for my procedure. I paid 0 interest for 24 months, I think it was, maybe 18 months. And I just made like $15 a month payments on that credit card. So they helped me pay for a lot of my dental procedures. You just have to find an office that accepts this Visa Care credit card. I really recommend it because nowhere else are you gonna get 0% interest. And the minimum payment is so low. Then they upped my limit when I got the next procedure and they gave me $3,000 limit. So I could stay well underneath that, and the minimum payment was only $30 a month, and there was no interest. So I just paid the $30. It never became more than $3,000, the cap. It always stayed at $3,000 where I charged it. It wasn't $3,200 by the time I was done. So I really appreciated that card. That really helped. So if you're looking into financing it and you're like, how am I going to do this? CareCredit, and I think they're a little bit more lenient about like previous like credit history and stuff because they understand that you're not getting this card to like go buy shoes. You're getting this card because you want to take care of your health. So you can also get them for your pet's care, pet care for your dog or your cat or whatever. You can do it for surgeries in general. I think you can even run it for like child care, child labor, medical of any kind. So definitely look into providers that accept CareCredit. Look at their website, carecredit.com. Their offices are so nice. The phone lines are so nice. When I call in, they actually sent me a congratulations card in the mail when I paid off the card. I was like, wow. Capital One never did that, So I was really impressed with that. But anyway, back to the implants. So my whole point of doing this video wasn't to gross people out. It wasn't to talk about the money or anything. Really what I wanted to tell you was if you need to replace some teeth, it's nothing to be embarrassed about. It's nothing to be ashamed about. Go do it. I'm 27. I'm walking around with 3 implants and a bridge, which is basically a fake tooth with your 2 real teeth surrounding it. So I just want you to know that it's not something you can't do. It is affordable. And I mean, maybe not on all budgets, but if you can pay $15 a month or $25 a month over the next 2 years to pay for it, what's stopping you? You know, don't have the shame that I felt about my mouth. I had a shame. Every time I tried to sing, I was always like, oh, you know, trying to hide my mouth because I didn't want anybody to see. And now I am proud, and I'm kind of loud too, but I don't care. I'm taking care of it. It's the best feeling I've ever had. Like, I feel like I'm doing everything in my power to take care of myself and my dental health, because there are a lot of things that can happen when you don't take care of your teeth. So I just really wanted people to know that it's nothing to be ashamed of and that you don't have to feel ashamed of it. You can take care of it. If you have any questions, you can private message me or comment below and give me your email address or something. I'd be definitely willing to talk about the recovery time. So basically, I had my implant put in yesterday on Thursday. Here I am on Friday, and I'm fine. Now, do I get dizzy a little bit and a little nauseous and going up and down the stairs can be a little scary? Yes. But just sitting around, you know, I put makeup on, I can walk around a little. I'm just not like, woo, let's go party, you know. But I would recommend taking at least that day off work. I did mine on a Thursday on purpose. So I'd have Thursday through Sunday off, just in case, you know, I didn't feel real great and I didn't want to drive on the Vicodin they gave me and stuff. But, yeah, if you guys have any questions about anything, please comment below. I don't want anyone to live like ashamed like I was, like I did. And I would be very willing to talk to you and answer any of your questions about what it feels like or any of that stuff. So if you haven't already, please subscribe. I do videos like this all the time. Did one about having braces as an adult. I did about getting my braces off. Now I've done this about implants. I've done about whitening. So if you're into dental stuff, subscribe. But also I do beauty videos. So if you're not already subscribed for that, I just filmed one about this makeup look. It's a very easy, natural, everyday look using a drugstore priced brand for makeup. So subscribe if you haven't already, and comment below if you have any questions. Thanks for watching. Bye.